Newsfeed Now. Coronavirus facts, not fear, begins now.
Good Wednesday. Welcome into Newsfeed Now. I am Aaron Nolan. April the 22nd. April continues to rage on. Numbers as far as the coronavirus continue to rage on as well. So let's take a look at our national map and check out exactly what's happening here. In the United States, 813,000 cases, nearly 45,000 deaths. The hot spots remain the same. New York with more than 250,000 cases. New Jersey with 93,000. California with 35,000. Louisiana, New Orleans has been a hot spot. Michigan has been a hot spot, as well as Illinois. New details reveal that the very first fatal case of the coronavirus in the U.S. was actually earlier than we thought. Officials in Santa Clara County, California say autopsies now confirm that 2 people died 3 weeks earlier than the first reported fatality in Kirkland, Washington. The medical examiner says the people who died in February did not have any known travel history and that it's presumed they got the virus from community spreading. President Trump has tweeted that he will sign an executive order prohibiting immigration into the U.S. today. Administration officials are still hammering out those details. He said the executive order will apply only to people seeking green cards and will not affect workers entering the country on a temporary basis. Now, some states are preparing to move forward and reopen business. But health officials say this might only be the first round of the battle against COVID-19. John Lawrence has the story.
19 might give new meaning to the phrase home for the holidays.
The concern is that in the fall, both coronavirus and flu might hit at the same time.
Dr. Robert Redfield, the head of the Centers for Disease Control and Prevention, tells the Washington Post a second wave of the coronavirus later this year could be more difficult than the current strand.
Are there going to be enough hospital beds? Are there going to be enough ventilators? Is there going to be enough PPE?
As for the
We have shut this state down. To be kidding me.
Protests in several states over the past few days calling for an end to stay-at-home restrictions.
There's young people trying to support their families, and you've decided, no, you're non-essential.
Last week, President Trump unveiled suggested benchmarks for states to start easing social distancing measures. But Redfield called for state officials to continue promoting social distancing and to increase contact tracing and testing.
We are one of the states with the lowest testing capacity. So is this okay? No, but we're going to have to be creative and innovative in terms of how we look for solutions, because it is really clear that we cannot rely on the federal government to help us out right now.
I'm John Lawrence reporting.
John, thanks. As states begin to reopen, many are ramping up the way they track the spread of COVID-19 in Ohio. State and local health departments have people working as disease detectives, trying to expose every clue about how this thing spreads and how to alert people who may be at risk of getting infected. Here's Ed Galek.
How did I get it? I have no clue.
Meet a COVID-19 patient, you might ask, how do you think you got it? The Fox 8i team has found state and local health departments have disease detectives investigating every positive test, trying to find out more about how the coronavirus spreads. But tracking this, incredibly hard.
I never imagined this. I never seen this. I never seen this coming.
And it is a lot like the
County Health Commissioner Donna Skoda tells the I-Team workers there have looked into hundreds of COVID-19 cases, maddening since the coronavirus makes people sick in so many ways.
I've talked to a lot of individuals who were confirmed cases. It was a sniffle and a headache. I never really got sick. And then we talked to that 15% that got really sick. So while we're investigating it, we're trying to learn about it.
So don't be surprised if you get a call from one of these disease detectives. As soon as someone has tested positive for COVID-19, the department will quickly try to contact that person's friends and co-workers, really anyone the patient has had contact with, even days before showing symptoms.
So the goal really is to contain and protect other individuals.
Tara Perkins and the Lake County Health Department investigating there too? Are more people sick in certain towns? Is there a connection between outbreaks at nursing homes?
This is information that we are working on within Ohio as a whole. We want to identify trends, individuals that may have been at more risk than others, if there was a particular age range that was more affected.
You can't see the virus, but now you see how health departments are gathering every clue to try to understand where and how the virus will hit next.
I've had enough of this stuff that's lasts a lifetime.
It's tough to hear those things. You see a senior citizen there saying it's enough to last a lifetime. Ed joins us from Cleveland. Ed, we're trying to find some sleuths right now that are going to find out as much as possible. Obviously, all of us are doing our research here, but tell us, Ohio.
Well, they actually have entire teams of people dedicated to this right now. In fact, one county told me that that county has as much as a third to a half of the entire staff now dedicated toward tracing back cases of people who test positive to see who else might have interacted with that person and how that person may have contracted it.
Yeah, again, you said it in the story. We don't know much about it. We know that you can sneeze and it can, you know, the 6-foot rule. As long as that sneeze doesn't go 6 feet, it's not going to get on you. It's not going to hang out in the air. But a lot is unknown. Talk to me a little bit about what is going on in Ohio as far as the numbers are concerned. Are we seeing that flattening that everyone's been talking about in order to get back to that reopening stage that the president is allowing states to do?
Well, we keep both ends of the spectrum. We keep hearing that the curve has flattened, but at the same time, for instance, in the city of Cleveland yesterday, there were 5 more deaths in the city of Cleveland and 28 new cases, which is the biggest spike for deaths and new cases in the city of Cleveland since this whole thing has started. But overall, the state is saying that we are seeing a flattening of the curve, but that doesn't necessarily mean a big decline.
What's the reopening plan? What is your governor given when those non-essential businesses can start to reopen?
Well, they're still talking about trying to do something around May 1st with certain kinds of businesses, although the exact specifics of that are still being worked out. We still have people protesting here in Ohio, as we do in many other places, saying, open it up more quickly. It's time to go. Let's get this over with. Let's get back to normal. But the governor is resisting that to move too quickly. So it's still being formulated as to what exactly will happen. We think something's going to happen here the beginning of the month, but again, the exact specifics still aren't clear yet.
Ed, thanks so much. Appreciate you taking the time out of Cleveland. Moving to New York State, it's the hardest hit state. And now a family is mourning the loss of a loving mother who was only in her 50s, and she died, it's tough to say, on her daughter's 18th birthday. Here's Kelsey Anderson.
You watch the news after every day, oblivious to the fact that it seems like, oh my God, again and again. And then it finally hits home, like really, really close. And then you realize it's not a joke. It's not, obviously.
Chris Malicki is a longtime family friend of the McCrorys. He's coached 18-year-old Gabby on the ice for about 10 years. He called Pam's husband Bill to check in this weekend and heard Pam was doing better. He could actually hear her in the background of the phone call. 2 hours later, though, he received a text that she was gone.
I mean, I was floored.
Malicki says Pam and Bill showed a love you don't see often.
Bill and Pam would get up at 4 o'clock in the morning every day.
And their only child, Gabby, is their world.
That was it. It was just the 3 of them.
Pam worked in food services at a local hospital. That's where it's believed she picked up the virus. Before this pandemic, when the girls were at away hockey tournaments, everyone was very well fed.
Wraps and foods and subs, and all the girls would always run to their room to get food because she would bring a microwave, a crock pot, and everybody knew if you wanted to eat, we go to Pam's room.
And that giving motherly spirit wasn't just seen at hockey tournaments. Chris says Pam and Bill were the neighbors you'd always want around.
Working genuine, they give you the shirt off your back if you needed it. And they would do that to anybody. They were just that kind of family. Typical Buffalo, hardworking, we're the city, good neighbor type of people. They totally exemplified it 100% and then some.
Let's go live to Buffalo, New York. Kelsey joins us now. Kelsey, obviously, these are the type of stories we hear all the time. How difficult are these stories to hear and then to tell those stories? And, you know, we're not supposed to be overly emotional, although these are topics that no doubt will mess with our emotions.
Yeah, absolutely. I mean, first of all, every show we start out with in Buffalo, we say the numbers, and we're just really trying to put those faces, as you said, to some of these numbers. And it's devastating. I mean, this mother was lost on her daughter's 18th birthday, and what's even worse is now the daughter and father aren't allowed to even leave their homes for 2 weeks because they were in the same home as a COVID patient. So now they're quarantined by themselves, can't even get a hug from an extended family member for a couple weeks. The emotion part for, you know, on my side, you know, you do try to keep your heart off your sleeve a little bit, but it is really tough because we're telling these stories now every single day, and these are our neighbors. It's really tough to see.
Let's talk about the numbers there. Obviously, it is the hardest hit state. What about in your area, as you are really on the other side of the state from New York City?
Yeah, Buffalo to New York City, for those who don't know, about 6.5-hour drive. So New York City has hit their peak, their plateau, and they are, it looks like, on the downslope of things a little bit. Buffalo, Erie County, the county I live in, still on the upswing. So, you know, we are still on the way up. So, you know, obviously our leaders here in Erie County aren't ready to do any sort of reopening or anything like that and right now. But, you know, we are going to obviously take leadership from our Governor Andrew Cuomo.
Yeah, I'm sure that you guys reported on this yesterday. What can you tell us about the President Trump and Governor Cuomo meeting from yesterday in the Oval Office?
Yeah, we, you know, reported on that yesterday. Governor Cuomo came on the newscasts after that yesterday, and, you know, we'll see. Cuomo has said throughout this entire process that he wants to keep politics out of this. He has public health in mind, number one. Cuomo get a little upset with our president, and it was kind of the first time that we had seen that. So we'll see how that, you know, goes, but obviously all eyes are on New York State because we do have the most cases and our testing is ramped up. So I think the governor and the president are going to have.
Kelsey, thank you so much for reporting for us out of Buffalo. Let's move to Tennessee, into the South. One woman tested positive and felt it was important to let her friends and family know, but now she says she's facing social stigmas and all she really wants to do is get back to the normal. Here's Brooke Reese.
I actually was not private about this at all.
Ailey Green took to social media to let her friends and family know she had coronavirus.
Was very open about the experience, and it was really met with a lot of curiosity and supportive messages.
The social worker says her symptoms were very abnormal.
I've had no cough, I've had no fever, I've had no shortness of breath.
Only a sore throat for the last 2 weeks. But after a coworker at Vanderbilt's psychiatric hospital tested positive, Green felt she better get checked.
I feel very hyper aware that I have it and might be, you know, contagious.
Green explains her friends and family have been hesitant to interact with her in person.
I'm definitely going to be really mindful, I think, about just like physical affection for a long time. Like, can I give like a hug?
Making it difficult to consider when life may go back.
In a way, feel like I'm kind of walking around with a scarlet letter, so to speak.
Something she feels may not go away quickly.
I'm very aware of kind of what depression and anxiety kind of looks like and might feel like, and so it's definitely a big toll on my mental health to just kind of feel the isolation.
Green hopes to get back to work soon and start to regain a sense of normal routine once again. But only time will tell how those around her will cope with COVID-19. In Nashville, Brooke Reese, News 2.
Brooke, thanks so much. Let's go to Josh Breslow now. Josh, Brooke did a really good job in that piece, reminding us that, you know, it's sometimes just not a physical game. It's a mental game as well, not only with isolation, but also who have had the coronavirus.
Yeah, no, for sure. And that's, I mean, something that people are going to think about, mostly because, as she kind of mentioned there, people want to come forward and say we need to get tested and we need to learn more about this. But then you have that stigma where people are saying, wait, you had the virus, stay away from me for a little bit longer. So there's a lot to that from what Brooke was saying, and something that will be with us for a while here.
All right, I'm asking everyone today about new numbers. How is Tennessee doing? How is Nashville doing? Of course, Memphis, obviously a concern, is there. Big cities there in Tennessee.
Yeah, so the numbers actually just came out for Nashville specifically, and they were talking a lot about a racial disparity here, which we're hearing across the country. So the numbers are actually kind of trending downward as far as active cases go, but the one thing they are looking at here is going to be that racial disparity, where you have about 40% of people who have confirmed cases being white, 13% black, and the disparity there is that in deaths, we've had 22 here, and 10 people are white, 9 are black. So they're looking into that there. Thankfully, the case numbers are starting to fall just a little bit, but that's going to be an issue and something that they will keep on investigating.
Before you go, is the target still to be able to open here by the 1st of May?
Well, so for Tennessee, the governor is saying the 1st of May for businesses to reopen in almost all the counties. But for Nashville specifically, the mayor is saying it's really going to depend on the downward trend of these numbers. He wants to see the trend continue for 14 days. And at this point, we're about 3 days into a downward trend. So it could be just a little bit longer until businesses actually open here in Nashville. But yeah, in Tennessee, we're talking about May 1st.
Josh, you may not have the answer to this, but I'm curious. The president said that he's allowing states' governors to make the decision on when to reopen. Does it then become a decision of yes or no for each individual mayor? So my question is, could Nashville's mayor say, I'm not ready to open my city yet, even though the surrounding cities, take Collierville right down the street?
Yeah, no, he has said for sure, the governor has said that he understands that places like Nashville, Memphis, Knoxville, Chattanooga, they might wait a little bit longer. So he's kind of given them the power to do that. But 89 of the 95 counties here are set to reopen May 1st. But yeah, the governor said this is up to individual counties for most to decide.
All right, interesting stuff. Josh Breslow, thank you so much. Out of Nashville, let's go to Kansas now. Some of the recent cases are connected to meat packing plants. Those plants process up to 25% of the nation's supply of beef. Here's Hunter Funk.
Positive coronavirus cases have gone up significantly in southwest Kansas in the last few days. And with so many essential workers, many are concerned. Finney, Ford, and Seward County, all three have large meatpacking plants who employ a lot of their residents. And each plant has had positive COVID-19 cases.
In Seward County and Ford County and Finney County is that at the end of the day, we simply have a lot of people who work at those organizations.
Together, they process up to 25% of the nation's supply of beef, which has many concerned after Governor Laura Kelly has said some of the recent cases are connected to those plants. The Kansas Ag Secretary says they're working to make sure the plants can stay open.
I've actually had conversations almost daily here for the last 30 days with these entities. Trying to make sure that we keep them operating.
The CDC says there's no evidence that COVID-19 can be spread through food packaging. Both Finney County and Seward County have set up off-site testing centers to test more people.
Hunter joins us now from Wichita, Kansas. Hunter, obviously a lot is unknown. We've talked to someone out of Ohio, and they're looking to have detectives trying to figure out exactly what is happening with COVID-19. Now we look at the processing part of food. First off, tell me how these businesses are handling maybe some infection there within their facilities.
Yeah, so we have 3 meatpacking plants in western Kansas, and specifically, you know, Tyson, Cargill, and National Beef. They're talking about how they put up, you know, some screens like with plexiglass to make sure people are social distancing. Other thing they're doing is they're pulling some people off the line, which is kind of causing that slowdown. But they're switching jobs from going, you know, to being on the line to sanitizing more often.
Yeah.
So that and checking temperatures, and that's kind of what they've been following from here.
All right, so you did some research on the CDC, and no proof right now that COVID can be spread through meat that has been packaged. Is that correct?
Yeah. So they're saying right now that they're not
they're not finding any traces that it can be tracked through the meat packing process. So everyone's safe to continue eating beef. That's
looking like in Kansas over the past few days.
Specifically, I mean, we're seeing a really big increase there just because there are so many essential workers. But I mean, Kansas, I think we're just getting out of our peak. I think we hit 2,000. Don't correct me if I'm wrong, but we're about there. So we're starting to slow down from what we have heard from officials.
All right, much appreciate you taking the time. From Kansas, let's go south to Oklahoma. A 12-year-old girl made an enormous donation to folks who are struggling, and she hopes it's going to inspire others. Let's go now to Cassandra Sweetman.
This 12-year-old girl donated her entire life.
I know that they don't get probably a lot of breaks right now.
Abigail Kanya and her aunt Angela live in Denver, but they're Ponca City natives. They still have strong family ties here in Oklahoma, like Abigail's other aunt, a nurse practitioner in Tulsa, and her uncle, a restaurant owner in Oklahoma City.
We had a couple conversations about how our family is, or kind of the doctors.
Since the pandemic began, they've watched as industries struggle and wanted to help their loved ones and frontline fighters alike.
So we reached out and I said, well, we can help you, and this will be the first of however many. And then Abigail says, well, I can help too. And so we did.
Angela pledging $1,000 and 12-year-old Abigail pledging her life savings, $1,500 saved from birthdays, holidays, and her allowance. In total, $2,500 sent to her uncle's restaurants, Cafe 7 and the Hamilton, who in turn catered meals for Mercy Hospital healthcare workers.
I felt really grateful for and that I was able to do that, and that they get to have what they need right now.
A spirit of generosity they hope continues after the for charity remains.
We can't just be selfish about our things. We do need to be sympathetic.
Cassandra joins us from Oklahoma City. Cassandra, I've been talking about hope on our program, and I've been focusing that hope on reopening and finding a smile and being able to do things that are a little bit normal. But I hope in humanity is something that's also important, and I think you were able to find this in this story.
Yes, this family really cares about taking care of family and other people. The woman and her niece were telling me about is Ohana, which is this idea of taking care of family and putting them first. And it's something from Lilo and Stitch, but it's just these values that they're instilling in this little girl. And so when she heard what her aunt was going to do for her siblings, she wanted to help, but she said she didn't even think twice about it.
I want to do my Lilo and Stitch impression now, but I'm not going to. I'm going to refrain from doing the little monster voice. But I do want to talk about the money that was raised, $1,500 life savings, tag that on with another $1,000. This is someone who is giving outside their means, rather. That's amazing.
Yeah, and I think she recognized how much this business really relies on help like that, and she's don't need it right now. I'm very lucky that I don't, and I want to help however I can. So by giving them the money so that they can then do their job and cater and help other people who also need it, it was just a huge chain of generosity.
Does Abigail realize how much her story and just that little bit of positivity we need as not only the state of Oklahoma, the region of the South, but really the entire country and the world?
I would be surprised if she understood the full impact of how much her kindness has touched people, but hopefully she will understand. And she's extremely humble about it.
That is fantastic. Cassandra, thanks for telling us this story out of Oklahoma City. Well, that is our show for this Wednesday. You tend to forget about the day, so it took me a minute to remember that it is Wednesday right now. You can join us once again coming up with your coronavirus update, 10:30 tomorrow. See you then.